Welcome to the Deep Dive. Today we're jumping into something I know many of you deal with, or worry about. Feline lower airway inflammation. Specifically, chronic bronchitis and asthma in cats.
That's right. We've gone through some pretty detailed veterinary info, the kind of stuff your vet might read.
And our mission today is really to unpack this, to get to the core of what these conditions are, how they're similar, how they differ, basically give you the key takeaways without drowning you in med speak.
Exactly. Think of it as, well, a clearer path to understanding what might be going on if your cat has breathing issues. We'll cover the definitions, the why behind it, and importantly, what can be done.
Okay, let's get straight into it then. Chronic bronchitis, asthma. They sound really similar. Is there a fundamental difference or are they just labels?
That's a really good question. It kind of gets right to the confusion, doesn't it? So, chronic bronchitis. The definition is basically inflammation in those smaller airways, the bronchioles, lasting more than 2 months.
2 months, okay.
Yeah, and crucially, without a specific identifiable cause that we can pin down, it's just this ongoing irritation.
Got it. Persistent irritation, mystery cause.
Right.
And asthma. How's that different?
Asthma also involves airway inflammation, definitely, but it can be sudden, acute or chronic, like bronchitis. The big thing is how the airways react.
React how?
They become hyperresponsive, they overreact to triggers, and this leads to the airways narrowing, partly because the smooth muscles around them actually squeeze shut, constrict.
Ah, muscle constriction.
Right, and that constriction is generally considered reversible, especially early on. Plus, if you look at the cells involved, asthma often shows more of specific types, like eosinophils, lymphocytes, mast cells.
Okay, so if I'm trying to simplify this in my head, is it like bronchitis is more about the airway walls getting changed and thickened over time, that remodeling you mentioned, while asthma is more about the muscles squeezing those airways shut?
That's a pretty helpful way to think about it, yes. Bronchitis leans towards those more fixed structural changes, while asthma is often characterized by that reversible muscle tightening.
Okay.
But, and this is super important for you listening in a real clinical setting, telling them apart just by looking at the cat, or even with a standard physical exam, it's incredibly tough.
Really? No obvious signs?
Not really. No foolproof physical exam findings or simple blood tests that scream bronchitis versus asthma. It's usually more about piecing together clues.
Sounds like a diagnostic headache for vets. Any clue that might point more towards one than the other?
Well, the sources do mention one thing. If a cat's breathing gets noticeably better after getting a bronchodilator medicine, like, say, Albuterol.
Like in human inhalers?
Exactly. If that helps relax the airways and they breathe easier, that strongly suggests asthma, because those drugs work specifically on relaxing those constricted muscles.
Okay, so a good response to a bronchodilator points towards asthma. Makes sense. Now let's go a bit deeper. What's actually happening inside the lungs to cause all this inflammation? What kicks it off?
The main theory is it starts with inhaling irritants from the environment. Like dust, maybe smoke, aerosols, stuff like that.
Okay.
Once that irritation happens, it triggers this whole inflammatory cascade in the lower airways. One of the first things is that smooth muscle constriction we just talked about.
The reversible squeezing.
Right. Which, again, can often reverse on its own or with meds. But the inflammation itself causes other changes, too.
Like what?
Well, you get more goblet cells. Those are the mucus-producing cells, so more mucus.
Okay, more mucus.
Yeah, and the airway walls themselves can get swollen. That's edema. Think of your nose getting stuffy with a cold. Something similar happens down in their airways.
Swollen walls, extra mucus. Yeah, I could see how that makes breathing difficult.
Yeah, totally. And that mucus can cause real problems. It can actually plug up the tiny airways obstruction or lead to parts of the lung collapsing because air can't get through. That's atelectasis.
Wow.
And in really chronic cases, the airways can get permanently damaged and widened. That's bronchiectasis. Not good.
You also mentioned muscle hypertrophy earlier, the thickening being irreversible in bronchitis. How does that fit in?
Ah, right. So if that inflammation grinds on for a long time, those smooth muscles around the airways don't just constrict, they can actually get bigger, thicker. That's hypertrophy.
Unlike the temporary squeezing in asthma.
Exactly. This thickening is usually permanent. It adds to that structural remodeling, making the airways narrower and less flexible in a fixed way. That's more characteristic of chronic bronchitis.
Okay, the picture's getting clearer. We know what it is, sort of how it happens. Who gets this? Are certain cats just more likely to develop it?
Seems to be a worldwide issue, really. Cats everywhere can get it. But there is a definite breed connection mentioned.
Which breed?
Siamese cats seem to pop up more often in the stats. They appear overrepresented.
Interesting. So if you have a Siamese, maybe keep this on your radar.
Doesn't hurt to be aware, yeah. Age-wise, it can happen at any age, really, but it's most commonly diagnosed between 2 and 8 years old.
So young adult to middle-aged cats.
Pretty much. And one study hinted that females might be slightly more prone than males, but, that might need more research to be sure.
Okay, so worldwide, Siamese more often, 2 to 8-year-olds, maybe females.
Mm-hmm.
What signs should you, the owner, be looking out for? What makes you think, something's up with Fluffy's breathing?
The number one sign reported by owners is usually coughing, a persistent cough.
Okay.
You might also notice faster breathing tachypnea or just obvious difficulty breathing, like they're working harder to breathe. Wheezing is another one.
That whistling sound.
Yeah, exactly, like you hear with human asthma sometimes. And importantly, these signs can be episodic. They might come and go, could start suddenly or creep up slowly over time.
And what might the vet pick up during an exam?
Well, if a cat's really struggling, in severe distress, they might be breathing with their mouth open. That's a serious sign.
Definitely.
They'd also see the rapid breathing, maybe even cyanosis, that bluish tint to the gums or tongue if oxygen is low. And something very common is increased tracheal sensitivity.
Meaning?
If the vet gently presses on the windpipe, the cat might cough really easily, more than you'd expect.
Oh, okay.
Listening to the chest, they might hear crackles, like little popping sounds or wheezes, especially when the cat breathes out. But, and this is key, sometimes the chest sounds completely normal, even if the cat has significant airway disease.
Wow, so you can't always rely on hearing something. That does make it tricky.
It really does. The vet might also see the cat using its belly muscles to push air out that abdominal push, just generally more effort on the exhale.
Okay, we know the signs.
Yeah.
But what causes it? What triggers this inflammation in the first place? Are there things in the environment we should worry about?
That's still a bit of a mystery, the exact initial trigger, but we definitely know about risk factors that can make it worse, or maybe even contribute to starting it.
Like what?
Cigarette smoke is a big one. Just like for us, secondhand smoke is bad news for pets. Also, poor environmental hygiene, dusty cat litter.
Dusty litter, okay.
Yeah, and household sprays, hairsprays, air fresheners, that kind of thing. Basically, airborne irritants.
So clean air, smoke-free homes, super important, especially for these cats.
Absolutely. Oh, and there's one medication mentioned too, potassium bromide. It's sometimes used for seizures in cats, but it has been linked to causing similar respiratory signs in some cases.
Good to know. Okay, so a vet suspects bronchitis or asthma. How do they actually figure it out? What's the diagnostic journey look like?
It's really a process of ruling other things out first, the differential diagnosis, we call it.
Makes sense. What else looks like this?
Quite a lot, actually. Lung infections, bacterial pneumonia, fungal, even things like mycoplasma or toxoplasma. Heartworm disease is a big one to rule out.
Heartworm can cause coughing.
Definitely. And other lung parasites, too, like Illura strongylis or capillaria. Though some of those depend a bit on geography, like southern U.S., and if the cat goes outside and hunts.
Okay.
Then you have things like lung tumors, primary or metastatic, and even idiopathic pulmonary fibrosis that's scarring in the lungs. They all need to be considered.
So lots to rule out. What about basic blood tests? Do they help?
Often, the routine blood work, CBC, chemistry, is completely normal, which can be frustrating.
Yeah.
But in maybe 40% or so of cats with these airway issues, you might see higher numbers of eosinophils in the blood, that peripheral eosinophilia.
The inflammatory cells we mentioned earlier.
Exactly. It's not specific, doesn't prove anything on its own, but it can be a supportive clue, especially if you see it alongside the clinical signs.
Yeah, so blood work may be helpful, maybe not. Any other lab tests?
Yeah, a fecal exam is important to check for those lung parasite eggs, though, gotta say, false negatives happen, so a clear test doesn't 100% rule them out. Heartworm testing is crucial, looking for the worm antigen and the cat's antibody response. Especially if the cat is vomiting along with coughing, that can be a weird sign of heartworm in cats sometimes.
Vomiting, too. Huh.
Yeah. And interestingly, allergy testing, skin tests, or blood tests, they don't really correlate well with respiratory disease in cats right now, so not usually helpful for diagnosing bronchitis or asthma specifically.
Okay, so allergy tests are out. What about pictures?
Yeah.
X-rays?
Chest x-rays, yeah. Radiographs, very important step. The classic look is this diffuse thickening of the bronchial walls. Sometimes they look like little donuts or parallel lines, tram lines we call them.
Donuts and tram lines, got it.
But you can see other patterns too, like hazy patches. Yeah. And a really critical point, how bad the x-rays look doesn't always match how sick the cat seems.
Yeah.
Yeah, you can have pretty significant disease with totally normal-looking x-rays sometimes.
Good to remember. A clear X-ray doesn't mean a clear bill of health.
Yeah.
Are there specific X-ray signs vets look for, though?
Yes. They might look for signs that air is getting trapped in the lungs, hyperinflation. That can make the diaphragm look flattened, or the space between the heart and diaphragm seem bigger. The lungs might look like they extend further back than usual.
Okay.
Sometimes you might see collapse of the right middle lung lobe specifically, probably from a mucus plug blocking it off. And if the main blood vessels in the lungs, the pulmonary arteries, look enlarged, that definitely makes you think more about heartworm.
What about ultrasound? Echo?
Echocardiography, yeah, ultrasound of the heart. That's really useful for ruling out heart disease as a cause of the signs, and also checking for secondary pulmonary hypertension, high blood pressure in the lungs, which can sometimes happen with chronic lung issues.
Yeah.
And it's another way to look for heartworms.
Okay, so imaging helps build the picture. Can we get more direct look inside the airways?
Absolutely. There are procedures for that. One is a transoral tracheal wash, or TOTW.
How's that done?
Usually under anesthesia. A sterile tube goes into the windpipe, and a smaller catheter goes down through that to collect fluid from down near where the trachea splits into the main bronchi.
And what do you do with that fluid?
Send it for cytology, look at the cells under a microscope. In bronchitis or asthma, you often see more inflammatory cells, especially eosinophils and neutrophils.
Eosinophils again.
Yeah, but a caveat, you can find some eosinophils, maybe up to 20%, in healthy cats' airways too. So it's not always a slam dunk diagnosis just based on that.
Right. Can you actually see inside with a camera?
Yes, that's bronchoscopy. A small, flexible scope goes down the airways. You can directly visualize the trachea and bronchi.
What might you see?
Often signs of inflammation, redness, swelling. In bronchitis, you might see lots of thick mucus just coating everything. It gives a really direct look.
Makes sense. What about bacterial cultures from those samples?
Yeah, we usually culture the fluid. While finding some bacteria isn't that unusual, finding high numbers might suggest a secondary infection is complicating things. It's not typical for uncomplicated bronchitis or asthma, though. Sometimes a special mycoplasma culture is needed if that's suspected.
And lastly, biopsy. Taking a tissue sample. When does that come into play?
Biopsy, yeah. Taking a tiny piece of airway tissue, maybe during bronchoscopy or sometimes with minimally invasive surgery, it can be really helpful to differentiate bronchitis from things like idiopathic pulmonary fibrosis or even cancer, which can sometimes look similar otherwise.
Okay, that covers the how we find out. Now, the big question for owners, how do we treat this? How are bronchitis and asthma managed?
Right. The goals are basically twofold. Reduce that inflammation and open up the airways. First step is often environmental control, getting the cat away from any suspected triggers.
Like the smoke or dust we talked about.
Exactly. If a cat comes in really struggling to breathe, an acute crisis, they definitely need hospitalization.
And what happens in the hospital?
Oxygen therapy is number one, getting them enough oxygen. Then, fast-acting bronchodilators, often injectable, to open those airways quickly. Sometimes sedatives, too, to reduce anxiety because stress makes it worse.
Gotta keep them calm.
Definitely. Minimal stress handling. Activity-wise, they usually limit themselves, and if the cat's overweight, a diet plan is often recommended, as obesity makes breathing harder.
Makes sense. Once they're stable, what do owners need to know for the long haul?
Client education is huge here. You need to understand this is usually chronic, progressive even.
Meaning it doesn't just go away.
Right. Even when the coughing or wheezing stops with meds, the underlying inflammation is likely still there. If you stop treatment, the signs will probably come back and the disease can worsen over time. So lifelong management is typical.
Lifelong. That's a big commitment.
It is. It often involves both medication and keeping up with those environmental changes. Sometimes vets can even teach owners how to give emergency meds at home, like an injectable bronchodilator or steroid for sudden flare-ups.
Having that backup plan must provide some peace of mind. Okay, let's talk specifics. What are the main medications used?
For an emergency, like in the hospital, it's oxygen, plus an injectable fast-acting bronchodilator like terbutaline. That dose might be repeated if needed.
Okay.
Sedatives, as we mentioned, butorphanol, buprenorphine, maybe asapromazine, carefully chosen, of course, and a short-acting injectable steroid like dexamethasone to get that inflammation down quickly. That might also be repeated.
And for the day-to-day long-term management at home?
Corticosteroids are the mainstay for controlling inflammation. Usually, oral prednisolone is preferred over long-acting injections.
Why oral?
More control. You can adjust the dose easily, monitor for side effects better, typically start higher for maybe a week or two, then taper down slowly to the lowest dose that keeps symptoms controlled. Maybe daily, maybe every other day.
And the long-acting shots.
Generally reserved for cats where giving pills or inhaled meds is just absolutely impossible for the owner.
Okay. You mentioned inhaled meds. Tell us more about inhaled steroids for cats.
Yeah, they're a great option. Things like Fluticasone, brand name Flovent. You use a special spacer device with a face mask designed for cats like the AeroCat.
A little kitty inhaler mask.
Pretty much. You attach the inhaler, puff it into the spacer, and the cat breathes it in through the mask. Maybe 1 or 2 puffs, twice a day, depending on the strength. A study even showed a lower dose worked well.
What's the big advantage?
It targets the lungs directly. So, way fewer systemic side effects than oral steroids. Big plus. But they take time to work fully, maybe 10 to 14 days. So you often start with oral steroids at the same time for quicker relief, then taper the oral meds off.
Okay, that makes sense. What about long-term bronchodilators? Are they used daily too?
Sometimes, yeah. They help keep those airways relaxed. There's oral sustained-release theophylline, though absorption can be variable in cats, usually once a day.
Okay.
Oral beta-2 agonists like terbutaline or albuterol are options too. And inhaled bronchodilators, especially albuterol, are also used. They work fast but don't last super long, maybe a few hours.
Any downsides to the inhaled albuterol?
Well, the standard form, racemic albuterol, has 2 versions of the molecule. Long-term frequent use of that might, paradoxically, worsen inflammation in some studies. So if a cat needs frequent rescue puffs, especially if they're severe, using the single R enantiomer form is often recommended now.
Interesting detail. What about other drug types? Dewormers, antibiotics.
Dewormers or anthelmintics might be tried empirically, meaning sort of a just-in-case approach if a cat has signs, high eosinophils in their airway fluid, and lives where lung parasites are common, things like fenbendazole or ivermectin.
Okay, and antibiotics.
Generally, only if you have proof of a bacterial infection, like a positive culture with sensitivity results or if mycoplasma is isolated. Just routinely giving antibiotics isn't recommended for uncomplicated bronchitis or asthma.
Got it. Any drugs to definitely avoid.
Yeah, beta blockers like propranolol, they can actually counteract airway relaxation and make breathing worse. Big no-no.
And precautions with the drugs that are used.
Sure. Long-term steroids, especially oral, carry risks. Increased chance of diabetes, suppressed immune system, maybe even triggering heart failure in susceptible cats.
Okay.
And the beta agonist bronchodilators can sometimes speed up the heart rate, so caution is needed if there's underlying heart disease. Careful monitoring is key.
It really sounds like it. Are there any alternative therapies that work? Like antihistamines or supplements?
Based on the current evidence in our sources, things like leukotriene blockers, antihistamines, even immunotherapy, there's just not strong support for them right now in feline bronchitis or asthma. The focus stays on steroids, bronchodilators, and environment.
Okay, stick to the proven stuff.
No.
So, looking ahead, what's the long-term outlook? What kind of follow-up is needed?
Yeah, long-term therapy and regular check-ins are the norm. Owners need to be vigilant, watching for any increase in coughing, wheezing, or breathing effort.
And tell the vet if things change.
Absolutely. Meds might need adjusting. Follow-up x-rays might be done sometimes. And because of the steroid risks, owners should watch for increased thirst or urination, potential signs of diabetes or kidney issues. Periodic blood and urine checks might be recommended by the vet.
What about prevention at home? Minimizing flare-ups?
Really hitting those environmental triggers hard. Strict avoidance of smoke, keeping the house clean, using low-dust litter, being careful with aerosols. Changing furnace AC filters regularly helps too. Anything to reduce airborne irritants.
Makes sense. Any serious long-term complications to be aware of?
Well, those acute episodes of respiratory distress can be life-threatening, unfortunately, and very rarely, with severe chronic disease, cats can develop secondary right-sided heart problems.
Okay, so wrapping up, it sounds like while it's chronic and needs management, most cats can live pretty good lives with this. What's the general prognosis?
That's generally true, yeah. With dedicated owners, good vet care, and adjusting treatment as needed, most cats do well. But there is a small percentage that just don't respond well. They're refractory, and their prognosis is, sadly, more guarded.
This has been incredibly informative. So to sum it up, feline bronchitis and asthma are complex, often overlapping conditions. Diagnosis involves ruling out other causes. Management is usually lifelong, focusing on corticosteroids, bronchodilators, and crucially, environmental control. And working closely with your vet is absolutely key.
Couldn't have said it better. And it really makes you think, doesn't it? Given how similar they look clinically and that we lack perfect tools to always tell them apart, what kind of future research might give us more precise diagnostics and maybe even more targeted therapies down the road for these really common issues? Something for you to chew on.